go ahead and get started. So good morning, everybody. I'm excited about this discussion today. And I think that you're all aware of the fact that, one of the 7 elements of the CACHI work is this notion of a portfolio of interventions, and just been diving into different discussions about that. And, just to remind you, the areas are, clinical services, community and social services, clinical community linkages, environment, and policy systems change. And so today we are going to hear from Erin Hagen, Dr. Erin Hagen. I'm very excited that you're with us. So she's the Deputy Director of the Evidence for Action, a national program from Robert Wood Johnson Foundation, and based in the Bay. And then we're also going to hear from Christania who is with one of the PHI programs. I am. Okay. Well, then maybe I'm going to just stop. And then I will just turn it over. When you're not talking, that would be great. And I will just turn it over to our. Great. So, Erin and Christania.
Sure. Well, hi everybody. Good late morning. Hope everyone's doing well. I'm Christania De Leon. Erin and I think probably can introduce ourselves more in depth in case you missed anything with the connection breakup when we get into our sections. But we actually wanted to start off because it's a relatively small group. So if you are on a phone, perhaps we could figure out a way we could all get unmuted. We wanted to learn a little bit about you and your sites and some of your ideas or perceptions around policy advocacy, either what comes to mind when we talk about advocacy, any concerns you may have, challenges you may have, even perhaps some successes you've had that you might want to share. We figured it would be a good round to get a sense of who's participating on this kind of webinar today, and then maybe give us some grounding in some of your ideas and perceptions around policy advocacy and what that looks like for you. Maybe we could start with people on the computer, on the web, if that's possible. Feel free to unmute yourselves. I think we could probably give each other some visual cues to chime on in. And we'll leave it to you guys to take it away.
This is Larry Gruder. I'm with Riverside County CACHI, and policy change, although policy change hasn't yet been a part of our portfolio, we haven't gotten there yet. Separately from our Accountable Community for Health Development, we have worked with Riverside County Riverside University Health System and Public Health. So that's the county hospital and the FQHCs. Our focus has been on obesity and diabetes prevention, identifying screening for prediabetes. And the FQHCs have adopted this screening as part of their normal practice. It wasn't when we began working with them that they saw the value of it. And so they've changed their policy as a result. But as I say, that we haven't built that in yet to our CACHI plan. But it's the one experience we've had that was relevant to this and positive.
Thanks, Larry. Anyone else on the web? We can move to phone. Feel free to unmute yourselves. Feel free to introduce your name, your site, and concerns, challenges, perceptions around policy advocacy generally. Should we call
I'll chime in.
Okay.
I know I'm not on the phone, but I think there's a lot of maybe uncertainty about what policy is and advocacy, and particularly who you're funded by and what you can do and what you can't do. And so I think, that's an important piece. And, I'm not sure that it's always kind of thought of as a go-to for some, so.
That's really helpful. All right, we've got a quiet bunch today, and that's okay. And we'll give you a heads up. We want this to be interactive. We want to make sure it addresses your ongoing needs and challenges. So I'll pause again in case anyone else wants to chime in and sort of either add a sort of confirming or building off of what's been said before, or adding another experience that they've had, or any questions or challenges up front. We'll give it another second. All right, so I guess we're feeling quiet this morning. That's okay. We've got at least some framing and some ideas of kind of what we're talking about here and what we're grappling with. And so I think it's probably important for us to start off by really thinking a little bit about, what is it that we mean when we say policy advocacy, and setting a foundation about what we want to really talk about throughout our time together today. And so I think it's important to keep in mind that when we talk about advocacy, we're talking about a tool that can be used very, very broadly and in lots of different ways and lots of different settings and lots of different contexts. And so 3 areas we tend to talk about when we talk about change making and advocacy are areas of policy, systems, and environmental change. And I wanted to talk a little bit about what each of these is, what they mean, what they refer to, because I think it can kind of open up some of the conversation around what we're talking about exactly when we talk about policy advocacy, advocacy as a tool, and sort of change making, and how those all work together. And so when we talk about policy changes, these typically are, I think, what come to mind when we say policy advocacy. These refer to changes in policies or codified practices at either legislative or organizational levels. So any institutional body that has a set of policies and procedures is a possible venue for policy change, even our own organizations. So adapting certain elements of our operating frameworks are key opportunities for us to think about ways that we can start to explore advocacy. So this can include changing legislation or advocating for new laws or amendments to current laws, but can also be working with school districts to increase access to services that are needed by their students, faculty, and staff. It can be changing procurement practices of our own organizations to use vendors that might reduce waste in their service delivery, or maybe ensure that you're procuring your products or services locally to support local communities and local economies. Whatever the level of intervention, these are all areas of policy change that can really make a difference in our work. I was able to be on the portfolio of intervention webinar that was last week around sharing economies. And those little changes that we can make to open up our resources and open up our doors to our community members or our partners and allies, these are all little ways that we can start to incorporate policy changes. They don't have to be at the legislature, don't have to be a legislative level, but can be really indicate, different incremental changes that we can make that are all avenues for advocacy. Systems changes, of course, are very connected, I think, to policy change, but they are looking at a much broader system of how things are implemented. And I think systems thinking, systems approaches are an integrated part of what you're working towards as Kachi sites and with Sue and the field team. So this level of advocacy seems actually really naturally connected to your ongoing efforts. So systems changes focus sort of one step beyond those policy changes. And they don't just want to look at, sort of the policies that are being proposed and how they're being proposed, but they want to change the very framework and infrastructures that are creating those policies and proposing them. So it's redefining our institutions, our institutional frameworks. They're setting the agenda to ensure that their practices are more equitable and more reflective of our missions and our values and what we're seeking to achieve. So this can include any range of things, from, if you're looking internally, making changes to maybe your hiring practices, ensuring you have a diverse team of staff that are at the table making certain decisions, looking at pay parity on your team. It's not perhaps just trying to mandate healthy meals in schools, but establishing a farm to fork program or effort within a school. It can be influencing who sits on a board or represents us in the legislature. It's focused on mobilizing the systems that we have in place to address the root of a problem, shifting power dynamics, and then ultimately working towards a preferred solution. So those changes, I think, are kind of a step a little bit more upstream, but I think that are really connected to how we're mobilizing to change health delivery and elements like that in your ongoing COCHI work as well. And then, of course, environmental changes are something I think that tend to come naturally to us who are working in both public health or healthcare fields, that are looking at changes that are made to our physical environments that might increase access to services or improve health and safety. So while they may be very place-based, they're not necessarily intended to benefit just one household or one set of individuals, but are looking to influence an entire community and sort of scale that opportunity for impact. And so these can include very commonly complete streets initiatives, increasing healthy food options in local markets or restaurants, supporting park usage, building local clinics in underserved areas. These are all examples of environmental change that can come quite naturally, I think, to a number of your COCHI sites and your initiatives as well. And so I'm also very aware that because of my background in more public health, that my examples tend to be a little public health heavy. So just, if you're working in the healthcare side, and that's an example of the space that you're working in, sort of the differences around policy and systems and environmental changes could be, for example, if in a hospital, policy change could be adapting a policy or a process to operate farmers markets on your campus. A system change could then be integrating referral systems, so you can develop a system to help patients who come in for certain types of chronic disease or certain kinds of triggers, give them information and connect them to other services that can allow them to access nutrition or physical activity opportunities, better safety and wellness information. And then an actual environmental change could be developing that on-site farmers market, for example, on certain days, which we've seen in Kaiser or various other hospitals, trying to sort of integrate a full approach. So there are lots of avenues to do PSC change, to engage in advocacy. And what I'll emphasize before I hand it over to Erin to talk a little bit about what she does, is just that, while every type of PSC change is different, they do have several things in common that I think are important to lift up. When we're talking about PSC change, we're not just talking about a one-time meeting or a one-time event or a very time-limited specific program that might only focus on behavior change or something like that. We're talking about interventions that are ongoing, that are adaptive, but are also very pointed at addressing strong systemic and upstream social determinants of health. We're looking at something that's integrated into a larger vision for change and is geared towards, hopefully, as I think everything we strive to do, is really geared towards sustainability as well. And so the other thing to keep in mind is, as we are developing ideas around how we can integrate advocacy, what opportunities or policy or systems environmental change are available to us, everything, these examples and everything that we can pursue is usually directly tied to the overall mission or vision of a project or an initiative. So if we truly embody our belief in equitable health systems, these activities can be a very natural and integrated part of how we do business. Advocacy and PSC change doesn't have to be a whole extra burden or something you have to add on, to the list of things to do. It can be a very natural part of how you embody your vision and how you embody your goals that can already be present in the work that you're leading. It just sometimes needs to be emphasized or capitalized on, and should always be very intentional But I would imagine that some sites maybe are engaging in some type of PSC change, or at least orienting towards that, and maybe don't recognize it. So hopefully this helps. I think having a strong vision and goal is a great place to start, thinking about the avenues where you can be most impactful and effective, and then trying to figure out, how to work to create some of those PSC changes can be a really great way to start thinking about how the role of advocacy in your work. So I'll pause there. I'm gonna hand it over to Erin, who I think is gonna get much more in depth into some examples and talk a little bit more about this, but we wanted to kind of provide some grounding and basis for the range of activities that can be included in this conversation.
Great, thanks, Chris. I am going to share my screen also, but while I'm getting ready to do that, I really appreciated Larry's opener about how you've been working in policy change, because I thought it was a great example of how policy change is not always legislative, the fact that you're working with a FHQC. And so I just wanted to pause for a minute and see if, now that Chris has given a little bit of more context around what policy systems environmental change is, and building off of Larry's comments, if other people do want to add while I'm sharing my screen.
I'm kind of afraid to talk because I don't know if there's something happening with my internet. But I just was thinking about Humboldt, that the other day they shared, we had just across the state, there were 5 two-day equity, diversity, and inclusion trainings. How they, took that information and I think are incorporating or beginning to incorporate some criteria into that. So, Christania, when you were speaking just about, looking at equity, right? I think that's another example. I don't know if the folks from Humboldt want to speak to that, or if anybody else who attended the training, if you're also kind of thinking in that way, like it kind of spurred some thoughts for you. So I just wanted to bring that up, Erin.
Yeah, great. I don't know who everyone, I don't have that that benefit of knowing who everyone is, but if people are on from Humboldt, that would be great to hear more about.
Mm-hmm. Well, I know they're there.
Hi there, Sue and all. Can you hear me? This is Jessica.
Yep.
Yeah.
Hi, sorry, I struggled to get myself unmuted there. So this is Jessica from Humboldt. We really appreciated the opportunity to participate in the EDI training. And I think sort of we are novices in the land of equity, diversity, and inclusion, but certainly willing and interested in sort of expanding our knowledge and action in that arena. I think probably like many catchy communities, we are embarking on a process to really come up with sort of the best set of strategies in our portfolio of interventions. And as Sue reflected, have developed sort of actually a variety of criteria in which to try and develop a more rational or actionable set of strategies to work on. And so at the EDI training, they presented a tool around equity lens. So for whatever work you're doing, trying to consider who does this benefit and who does this burden. And so we've included that as sort of a criteria in our process to sort of understand our strategies as a whole. And I will say it's pretty early days around that, but so far has been useful to apply that tool.
Great, thank you for sharing that. And in case anyone else is having a similar issue when you're trying to talk with us, if you're on the computer, you can hover your mouse over the picture of yourself and mute or unmute yourself. And if you're on the phone, it really should just be your mute or unmute button. So hopefully that's the case. And you are able to control your own muting. So it doesn't need to be controlled by Chris or by Sue. So let me give you just a little bit of background about myself so you know how I come to this space. So as Sue was mentioning, I am the Deputy Director of a national program for the Robert Wood Johnson Foundation called Evidence for Action. And we are one of 4 research funding programs that are affiliated or similar to each other, and we share this for action piece of our name. So there's evidence for action, systems for action, policies for action, and health data for action. And the for action part is a really critical part of the work that we do. So we fund people to evaluate interventions in a variety of different spaces. And for evidence for action, an intervention is very broadly defined to mean a policy or a program or some broader initiative or a partnership. And we're looking for really rigorously designed evaluations that can tell you at the end whether the intervention or the initiative was successful. And then the next piece is that information be shared with the people who make the decisions relevant to implementing those sorts of interventions. And so those decision makers are at a variety of levels. Sometimes they're policymakers, sometimes they are heads of hospital systems, sometimes they are departmental heads, and often these are people who actually aren't working in the health space. So the interventions that we are often funding are those that are designed to impact some other outcome, like financial security or housing or criminal justice reform. And we're looking at whether or not those sorts of interventions are also impacting health. And so unlike some of the traditional research grants, which really end with analyses and publication of the results in some scientific journal behind a firewall somewhere that nobody ever reads, it's really important to us that our grantees share this information broadly and accessibly with the people who are making decisions. And that means advocating, because really advocacy and advocating is a big umbrella term that encompasses a variety of activities. And I think a lot of times people confuse or use interchangeably advocacy and lobbying. And all lobbying is advocacy, but all advocacy is not lobbying. And that's really important coming from a foundation perspective, where we at the Robert Wood Johnson Foundation cannot fund actual lobbying. We're prohibited because of our tax exempt status from doing so. And so we have to be really clear for ourselves and for our grantees what it means to advocate without lobbying. And certainly this webinar is not, the purpose is not to have a advocacy versus lobbying 101. That's not where we're going. But I do think it's important to be explicit about that up front so that we can be clear going forward that this is something that anyone can do. And that when we say advocacy, we're talking about a whole bunch of different activities that could be relevant. So I thought what might be the most helpful for you all is if I share some examples from the grants that we've funded. Now, I think it's important to say, as I mentioned, that the grants that we have funded, the people and places we funded all over the country, in some cases probably have some similarities to the CACHI sites, and in some cases are different. But I think especially because of the collaborative nature of your work, that you likely will see some relevance, or at least hopefully will see some relevance to the projects that we have funded and to the examples that I'm going to share with you today. So can you all still see my screen just fine? Okay, great. So one of the really important reasons to advocate is to bring in different perspectives. So let's think some about the issues that you might be weighing in on. I think people are naturally more comfortable talking with people and in places in which they feel like they have some content expertise, or at least knowledge and contextual understanding of what's going on. It's more uncomfortable to go into new places where you don't know the lingo. I think in the health sphere, we're especially bad about our alphabet soup of acronyms. And the same is true though in other sectors. And so you don't always know exactly what people are talking about. But it can be really powerful to bring a perspective that is not new to a conversation. I think we've seen examples where we're all in the same room talking with the same people about the same thing. It's sort of the usual suspects. And so we know, we can anticipate what people are going to say. And it sounds sort of like this chorus that we're used to hearing. From my own background, I started my career in the childhood obesity space. I spent the better part of the first decade of my career doing childhood obesity work. And when I first started working in that space, it was primarily physicians and especially pediatricians who were most concerned about childhood obesity and who were really starting. Other public health professionals began to chime in and think about childhood obesity issues. But there was a real tide change when the Department of Defense in 2010 released a Too Fat to Fight report, saying that the security of the nation was at risk because youth who were trying to enlist into the armed services couldn't pass their physical exams because of youth onset obesity related diseases and physical challenges. And so that really caused people to sort of stand up and pay attention. And I think it was less because people were worried that the United States was not going to be a safe place to live because of childhood obesity, and more because there was this realization that if the Department of Defense has recognized that this is an issue, it must really be a problem. And I think that sort of perspective happens frequently when you have a new voice that comes to the table. So a couple of examples from our from the grants that we've funded.
You guys, wait.
So
You put yourselves on mute.
after we asked that everybody learn how to unmute themselves, now we're asking that you might mute yourself again because we can hear your background noise.
Okay.
Um,
I don't know. Sorry, I'm not sure who that is.
Sue, can't you mute everybody?
Well, I'm trying to figure out. I cannot. Yeah.
So I'm going to keep going for now.
Okay.
So a couple of examples from our grants that we've funded. I think some good examples are in the employment and wages space. So we have funded two different, well, actually we funded a few grants in this space, looking at the ability to have income mobility, upward mobility, the effects of increases in minimum wage, the effects of stable scheduling, the effects of matched individual development accounts. And what we have asked people to do is the goal of these programs is to improve financial security or decrease the wealth gap, or to improve financial literacy, improve savings opportunities. And we've asked people to consider, in addition, whether these interventions are also improving people's health outcomes. Because we know, or at least we think, that there are very strong relationships between income, wealth, savings, financial security, and health outcomes. And we're trying to understand, if you make changes that improve those outcomes for people, do you also see improvements in health? And so this example of the grant that we funded exploring the effects of wage in early childhood education centers is exploring the increase in minimum wage that has happened in Seattle and King County, and looking at whether that increase in minimum wage is yielding better health outcomes. And one of the reasons it's really important to evaluate these sort of interventions is that increases in minimum wage is a relatively debatable strategy for effectiveness, even of the primary outcome, which is financial security. On the one hand, there is the understanding that people really are struggling financially and can't even meet their basic needs. On the other hand, there is the argument that we live in a market economy and the market will correct itself. And so changes in minimum wage are short-term band-aids for a larger solution that is needed. So it's less that there's real opposition to decreasing the wage gap, and more that there is question about whether this strategy actually works. And so that's why it's really important to to go beyond anecdotal evidence and to look at empirical evidence about whether these things work. And I can tell you in this case specifically, it's still very early in the study, and so they are still gathering the data and haven't finalized their analyses yet, but they are learning that in fact people do make changes to correct for this increase in wage. So employers do make changes due to the fact that they're working on finite resources and they're having to pay their staff more and they don't actually have more money. And so they're making changes like requiring higher levels of education for the same job that previously existed, or they're hiring fewer people because they don't have enough resources to cover full-time staff. So I think these are the sorts of things where we have ideas about what we think will work, but it's really important to understand whether or not those things work and to share that information broadly, because these, of course, are strategies that are happening all over the country. And I'll talk a little bit more about that going forward. To touch quickly on the stable schedule study, the idea really is to give people more stability in their work hours, which will allow them then to have more control over their life outside of work, their ability to make schedules outside of work, to take care of their kids, to prepare for other additional income opportunities that they may need. And part of why it's important to look at the health perspective, in addition to whether or not stable schedules improves people's general living standards, and consider whether or not it is hampering business goals, is because it's often important to have additional arguments to be able to say, well, yes, people have better outcomes in terms of their ability to control the rest of their lives. That may be nice, but not sufficient to change the minds of the business, of the employers. When you can add to that, your sales did not decrease, or maybe they even improved. And then you can add on top of that, also your employees are healthier, and so they're using fewer sick days. This just begins to add to the argument. Again, just reminding you that advocacy really means arguing in favor of something, right? And so having this sort of evidence and bringing these other perspectives allows you to argue in favor of a solution that we know is effective. And bringing that different perspective to a field that is less common can be a powerful way of targeting your audience. And so the next point that I want to talk about is finding commonality in uncommon places. And so a lot of times we look for where are our shared goals, but oftentimes we may have different goals in different sectors, but the same strategy can help us to address those different goals. So a good example from the grants that we've funded is a study in Miami looking at the impact of a greening initiative on cardiovascular disease and other health outcomes. And so the city of Miami has gone about planting trees and improving the greenery in particularly low-income neighborhoods throughout Miami. Green infrastructure is really just a fancy term for trees and grass and bushes, anything that are plants. So they've been going about expending resources to plant greenery throughout low-income neighborhoods in Miami. On the one hand, the health community really cares about, are people being more active because they have more greenery in their neighborhood? Is the air cleaner? Are they shaded from extreme heat, etc.? Interestingly enough, the water sector, water management, sewer, etc., they have a vested interest in green infrastructure because it helps to divert rainwater from the sewer systems. And sewer systems are old and taxed, and in Miami especially, that is one of the primary issues facing the city in terms of sea level rise, is related to their ability to manage their sewer systems. And so there are these uncommon bedfellows, the water sector, the sewer department, and the public health sector, who are interested in green infrastructure for different reasons, but can advocate jointly together, can jointly argue in favor of green infrastructure solutions in Miami for the purpose, on the one hand, of improving physical activity and health and improvements in mental health, and then on the other, for the improvements to water resource management. So there often are these opportunities, and when you might not know that this is a shared goal or a shared strategy unless you share the information you're learning, unless you talk to others who are maybe not common collaborators with you about the work that you're doing. So then you want to think about really finding the right audience for advocacy and action. And I commended Larry's comment early on because I think that was a great example of finding the right audience. And I think often the first audience that comes to mind when we're talking about advocacy is a policymaker audience. And so if there doesn't seem to be a good legislative policy lever, or there doesn't seem to be a good opportunity to change legislation, often our minds move away from advocacy as an outcome. And I think this is a really excellent example to demonstrate that isn't always, that shouldn't always stop you from moving forward, even if what you were working on was an actual big P policy legislative intervention. So in Oregon, this study that we funded, the Breaking Down Barriers to Preventive Care, in 2008, the federal government reauthorized the Children's Health Insurance Program. And so in that reauthorization, states received flexibility that allowed them to expand prenatal care coverage to undocumented immigrant women if they so chose. So of course, not every state chose to expand this, the accessibility of this sort of care, but in Oregon they did, and happily from an evaluation perspective, they rolled it out on a county by county basis. So there was this rolling period of time where there were changes happening in some counties and not in other counties, but eventually all the counties were, this program was expanded to all the counties. And the program has this horrible name that it was called the Citizen Alien Waived Emergent Medical Plus program. Really, really bad name, but good outcomes from the program. So really what they saw is that for mothers, there was better access to prenatal care, there was increased preventive screenings, for babies, there was reduced infant mortality, and there was improved birth weight, and that there were also increased vaccination rates. So as you can imagine, here we are finishing this study a few months ago, and we're in the current political environment that we are in, where it's highly unlikely that the federal government is the right target for disseminating these findings, right? We're not seeing a federal government that's encouraging of providing additional services to immigrants, certainly not undocumented immigrants. And so we really had to think about, who do we talk to? Who do we share this information with? Who cares? Who can make decisions? The law itself is not changing right now, so we're not trying to push to have a new law or expand the existing law. And then what we realized is, well, there are a number of states that did adopt this expansion. There are a number of states who are providing this sort of care, and so they became the target audience. And what we weren't talking to them about passing a law. We were talking to them about what we had learned in the implementation of this initiative, explaining the lessons learned, giving them justification to continue these sorts of programs, even in an unpopular federal environment for this sort of work, and giving them evidence and, as I mentioned, justification to continue their work, to maintain and sustain the work that they have been doing. And so I think this just illustrates that your target audience could be your co-parts in other cities. They could be other counties, other states. It could be the general public. Advocacy audiences can be dependent on what it is you're trying to do. And so this was, I think, a really great example of an actual piece of legislation after it had been passed, and that there's still advocacy efforts to be done. And so the final piece that I wanted to talk to you about is about sharing lessons learned, which is, again, a way of arguing in favor of something for something. And so one of the real benefits of doing the work, doing this sort of work that you're doing, is being able to share what you're learning with other places, because these are big issues that people are grappling with all over the country. Many issues really do transcend place. And so, for example, most big cities right now are really experiencing a housing crisis. There's insufficient stock, there's the stock that exists is unaffordable, or it's falling apart, and it's old and in need of repairs. And so in housing, we know that these solutions take a long time to implement, and they're very expensive. And so to the extent that we can learn from what's happening in one place and apply it to what we're trying to do in another place, that saves us time, money, resources, reinventing the wheel. And so sharing lessons learned really helps with scalability, replicability. So again, this is actually an advocacy effort to share what you've learned with people in other places to help scale up or replicate successes in various places. So just to touch quickly on a couple of the examples from our grantees, the two kind of types of examples you're seeing here are housing, and then food insecurity also is another issue that really is prevalent, unfortunately, nationwide right now. And one debate is related to the current food bank systems and whether centralized, very large centralized hubs or many smaller decentralized sites are the better way to reach more people. And so what we learned, we funded a study in Dallas looking exactly at this question. And so what we learned from that study in Dallas will really be applicable to other cities, but especially to other food banks. And food banks can make these decisions, hopefully in cooperation with their cities. But again, that becomes sort of the advocacy target is, when we wrap up this study, is other food banks. And I just want to quickly say that I keep pointing out that advocacy is about sharing, arguing in favor of something. When you're talking about lessons learned, it's equally as important, if not more so, to talk about what didn't work, what did not work. And so making sure that if we can prevent, again, as I mentioned, reinventing the wheel, making the same mistakes, that's a really important aspect of sharing these lessons learned. I think it's also really important when you're thinking about these big issues to be clear about what is your purpose. Why are you evaluating this initiative, and what is your ask? So what's your policy or environmental or systems change that you're really focusing on? So for example, we funded an evaluation of this food is medicine approach, which is a medically tailored meals intervention for low-income people. And what they're really looking at is whether receiving medically tailored meals improves health and also decreases medical care cost and unnecessary utilization. Their target is health insurance providers, health coverage providers. And the reason that's their target is because if they can show that medically tailored meals saves costs and improves health, then they can argue to have these sort of interventions covered by insurance companies. But I think it's really important to be clear that that's the target. And we talked with them a lot as they were developing their grant to say, who cares? At the end of this, what if you find out that this intervention doesn't work? What if it doesn't decrease costs? What are you going to do? Stop providing meals to people? And they said, well, no, we're sure that the meals are helpful, but if they don't improve costs, then maybe we shouldn't be lobbying or advocating to the insurance agencies that they should be covering this. We should find other ways of paying for these sorts of services. So I think that's just really important to be clear about who the target is. Similarly, with this project, the Denver Pay for Success initiative, if they can demonstrate the effectiveness and value of a housing first model, so that's what they're looking at, is housing first. And just in case you're not familiar, housing first means you are allowed to enter housing without any stipulation. So you could be using substances, you could be unemployed, but you are provided housing. And there is quite a bit of argument nationwide about whether housing first is the right model, or supportive house, some other form of supportive housing, which would require you to be sober and sometimes have some sort of employment to be able to qualify for housing. So it's important to really look at whether or not these models are effective, which ones are more effective, compare across models. And in this case, they're really focusing on a population of people who are frequent criminal justice system involved. So it's very common in some cities where that actually loitering is a criminal offense. So you can be arrested for basically being homeless because you're sitting in a place for too long. And so what they're trying to show is that if we provide people with housing, not only do they have housing security, they also will be less frequent users of the criminal justice system. They also will have better health outcomes. In general, they'll improve, their overall outcomes will improve. And in pay for success initiatives, this is especially important because this really is showing, these are often braided financing models, meaning different sectors are putting in different amounts of money. And then you have to show that there's a benefit to each sector for the money that they're putting in to encourage those sorts of investments. And so, again, just really important to be very purposeful about who your what your target is, who your target is, what you're looking for, and what it is you're arguing in favor of, so that you're able to share both the successes and the pitfalls. So I think, just in summary, really given the inherent cross-sector nature of the CACHI sites, I think you all are especially well suited to do these sorts of things, lend your voice to bring the health perspective to a variety of different sectors, to think about how one strategy can yield different benefits for different sectors, identifying the appropriate target audience in different places or sectors. Because of your cross-sector nature, you have access to those different audiences, and then to really share what you're learning, starting by sharing with each other and then expanding to sharing to people beyond the CACHI sites. And I just want to, I think, wrap up my comments by sharing with you sort of how I came to this place of doing advocacy. So when I was first sort of getting into early in my childhood obesity work, I was running youth nutrition and physical activity programs in the North End in Hartford, Connecticut. And I was, one of the programs that I ran was on a weekend where I would bring in breakfast to a youth home, and I always brought fruit. And so I came to be known as the fruit lady. And one of the girls one day was so excited to tell me that for her birthday, they had gotten star fruit. Star fruit was something that I sometimes brought in the fruit bowl. And that she had really wanted star fruit for her birthday. And so she and her mom had taken the bus for an hour to get to the grocery store to get star fruit, because the closest grocery store that had star fruit was about an hour away. And I think in the public health sector, we hear this story like anecdotally, but this actually was the true story that someone was telling me about, how they had taken the bus for an hour and then they had to, and she was so excited about it. And I had this moment of thinking, you have to take a bus an hour to get fresh fruit. This is really, I touch, however many kids, 100, 200 kids every day in the programs that I run. And that's just such a small amount of people. And sure, they're better educated, they have a better sense of what it is they need to do to be healthy and make healthy choices, but there are all these things happening around them that are preventing them from being able to easily make those choices. And that's when I started thinking about, how do we make changes that allow people to make these sorts of choices on a more regular basis. And eventually, recently a new grocery store actually did open up in that neighborhood. And suddenly after that, I have heard from people that I used to work with there that kids come to the sites with bananas as their snack instead of Cheetos bags as their snack. So you can see that often people do want to make these choices. They're just sort of prohibitive. And I want to caution against this idea that if you build it, they will come, because I do think that the pendulum can swing too far in one direction. I think it is a balance of education and awareness and efforts in policy systems and environmental change. And so I encourage you all to take that approach to the both and in your work.
Thank you so much, Erin. I know that folks are in various stages of connection and communication, but we do want to have some time for questions for Erin or around any of these examples or some more of the work that she does. So we'll pause now for questions if people have questions for anything that she's talked about.
Christania, this is Sue. So I'm struck by, and I'm not sure that what I'm going to say is very articulate, but just like something Erin was saying, just about really understanding like the root cause of what the issue is. And, when I think about one of the frameworks that we use where we're asking folks to really get a systemic perspective of what's going on so that you can make sense of it, and just how important understanding that, but also understanding it from the user perspective. So the people who are experiencing whatever is happening, to really figure out what's the best policy, systems, or environmental change, or all three, to address what's happening. So, I'm just, listening, that, right? But hearing this and just how important that is, and just the notion of, Erin, the work that, is being done through this center to really evaluate, and some of the things, there is a theory, right? Like if you, raise wages, it's going to improve health. And just that notion of prototyping or, trying it to say, okay, well, what about that worked? And then how might we adapt that to do something differently? Anyway, so I was just struck a bit about that, and just thought it was great to share. And I guess a question maybe is, I don't know if you have anything to say around how sites are kind of thinking when they go in there, a proposal to say, well, we think this is the root cause, so therefore we're going to do this change. And then they're finding maybe that they're not, and how adaptive or nimble RWJ can be kind of in this environment when it is pretty exploratory, it seems like. So anyway, just, I don't know if you have any reflections or thoughts on that.
Yeah, I think that's really so important. And it's another thing that I think makes evidence for action different than other research funding, especially big health research funders like the NIH. So because we fund evaluations that are often designed to impact some other system or sector, we really do want people to collect all the data that is going to be most relevant to decision makers. And so while we require people to collect health outcome data, we also want them to collect other data on the issue that is really designed to be impacted. And most of the time, people are coming to us adding health outcomes to what they're already doing. But there have been some instances, one specific example where someone came to us and was wanting to evaluate an intervention that was happening in a school system, and they weren't collecting any sort of academic outcomes. And we actually said to them, they did have health outcomes, and we actually said to them, you probably should look at the academic outcomes too, because the school who ultimately will make the decision about whether or not to continue or scale up this intervention is really going to care about academic outcomes for their students. And so I think that it is important. So I imagine even in your sites that people are trying interventions that have a high likelihood of working related to something. There's some sort of outcome that is relatively known, and then there are other aspects that we don't know. So maybe they're trying to integrate maybe they're trying medical legal partnership. They're trying to integrate legal services into the medical system. And there are a lot of things to know about that, right? We need to know if it improves costs and decreases unnecessary utilization, and if it improves people's health. And so I think as long as you have a theory of what you expect to happen and you design a study that really can test that, so that at the end of the day, if you see that it did not impact people's health outcomes, you can say that's because the intervention did not impact people's health outcomes, not because we didn't design the study to test that. That's what's most important, because if we are one of the things I love about E4A is that we don't fund sort of the exploratory in terms of let's figure out if these things are associated with each other. We fund the let's try to do something about this problem and let's figure out whether that something works. It's okay if it doesn't work. We have to try things and figure out if they work or not. We have had more null findings than I think people would like to have seen, but for us, that's not a failure. It just means that we know what doesn't work, which is also important.
Yeah, that's awesome. Yeah, interesting. Another, just, your speaking made me think of a meeting that I was at the other day, and how it made me think about, right now the hospitals are doing community health needs assessments, and they're very, I would say for the most part, pretty traditional. Right. And so thinking about having even these sites, if they're involved in that, like an example was in Imperial County with the high rates of asthma. And so you would normally maybe just look at that, but then they really started exploring the geothermal, like what's happening there, what's happening to the soil, what's happening to the houses, how much does that cost? And then so it was kind of like you saw, this issue, which is normally like, oh, it's asthma, right? But then going deeper, but even deeper, looking at costs, right?
Yep.
Which then can lead to activities, I think, that an ACH do, and also potentially the wellness fund, right? So just even broadening your perspective of that iceberg of what you see and what really going deeper to get to that root cause is, I think, just really important for, the sites, like as if they're involved in those activities, to really be curious.
Yeah.
I think so.
And that we see this a lot. We have to be relatively flexible as a funder, because a lot of what we're funding is primary data collection, actual real world. We're not funding lab science. People are implementing interventions in the real world, and stuff happens all the time. And stuff that you don't expect is related to what's happening in your world, right? So for example, in the Dallas Food Bank study that I was mentioning, shortly after the election, they noticed a huge fall off in people coming in to pick up their food. And what they learned was that people were just afraid to come into a site that was perceived to be affiliated with the government, and they weren't sure about their status or their safety for immigrants, especially in those places. And so that also impacts the study, because suddenly there are all these people who are participating in your study who are not showing up to pick up their food. But then it created this opportunity, partially because the evaluators are trying to find their participants, are going out, knocking on the doors, asking people like, why aren't you coming to get your food? And then they hear this from them, which of course is anecdotal. I mean, these are what people are saying. So this is, individual experiences. But it also allowed them to say, no, you should come to get your food. There's no reason. I mean, sure, there's reason for people to be worried, because that's a valid, you don't want to invalidate people's experience, but you are safe to come to this place and pick up your food. And so there were also just issues that came up with following participants and finding them, and reasons why people come or don't come. And beyond the study, these are people's actual lives, and they're not picking up food that they actually need. And that's just one example, but similar things happen in these contexts all the time. So I do think that we've learned how to be creative and how to be understanding and flexible in maintaining rigorous science, while also recognizing that the real world does not work like a lab.
Yeah. Hmm. That's great. Thank you.
Thank you so much, Erin. We're gonna swap our screen sharing, just a moment. Sorry, okay. So wonderful. So this is Christine De Leon again. I'm with CA for Health, and I'm just going to build off of, I think, what the great foundation that Erin set for us and some of those examples, and tie it into some more kind of elements around COTCHI, and share a little bit more about myself and the things that we do at CA for Health. So I work as the Product and Policy Manager with CA for Health. We are a project of the Public Health Institute. In terms of my background, I guess either as someone whose work is either focused specifically on advocacy or sort of big P policy or small P policy change. I've worked and volunteered with a range of organizations that focus on anything from women's rights, both here in the US and overseas, homelessness, education, promoting diversity. I joined PHI 7 years ago, where my work has really focused on honing into that public policy and advocacy space, developing community-driven programming, looking at capacity building, and generally seeing how we can bring social justice issues into the forefront of our public health efforts across California. So that's a bit about my perspective and my background as well. But I do want to share a little bit about CA for Health, who we are, what we do, and what PSE change looks like for us as an organization, and then tie it into the elements of your ACH work and how they're really ripe and really primed for different types of advocacy work and policy change efforts. So for folks who don't know, CA for Health is an inclusive statewide community of practice. We are comprised of very passionate, diverse, and committed individuals and organizations working to advance chronic disease prevention and health equity across the state. We work to provide platforms for intersectional thought, dialogue, and action. All of this is really centered around our belief that if we increase our collaboration, we foster non-traditional partnerships, we can tackle tough challenges together and ultimately create lasting change across the state of California. You can learn more about us at caforhealth.org. Our work is primarily focused around 5 key pillars of work. So we do convenings, we do a lot of organizing, we promote a lot of local stories, local successes, local leadership. We do some leadership development and find opportunities for that. And advocacy is the last core pillar of our work, of course. And so we, do a lot of work around a range of policies, systems, environmental change efforts across the state of California. We jointly develop our advocacy platform with our network members and a coalition of partners. So I think probably very similar to the ways that ACHs are growing out your collaboratives and your partners. We operate in a very similar way and use their insights, their needs, their expertise to inform our advocacy objectives. So for this year, we're really focusing on issues like food justice, poverty reduction, housing, immigration. These are all parts of the conversation that across the state are all kind of playing into what Californians are advocating for and what health equity is really being shaped around as we continue to move forward of course, in this changing landscape. So for us as an organization, PSE change is connected to and all starts with our values and our mission. So as you see here, as I mentioned earlier, we're focused on increasing equity and health equity across the state, and hoping that that also correlates to a lower prevalence and incidence of chronic disease conditions in the state of California. And so we have a range of opportunities, and I think some of these might resonate with perhaps some of the work that you might be doing either as part of your ACH or perhaps in your organization more broadly. We do things like advocacy days at the Capitol that complement a year-round portfolio of advocacy opportunities. Before coming to CA for Health, I staffed an initiative called California Convergence. We worked to adopt healthy meeting guidelines that included, structures around procurement, types of foods, physical activity commitments we had to make every, couple of hours in our meetings that created more inclusive spaces and, of course, healthier spaces. We've hosted events and meetings that focus on bringing innovative finance conversations and tools to community leaders and bringing community partners into those conversations. We work to bring community and grassroots leadership into our institutional partners and their decision-making, their collaborative processes. These are all kind of just examples of different levels of advocacy and PAC change that we're engaged in that kind of help breathe life into our objectives to collaborate inclusively and take action. And I think all of these sort of connect to what your ACH sites are doing and the goals of CACHI overall. I think in some ways, the bridge for PSC change for CACHI is really built into your structure, your mission, your goals, your values. CACHI is set up as a way to innovate and foster collaboration across sectors and health systems and seeking to address community health in a comprehensive and collaborative manner. Whether we call it PSC change or not, CACHI is a model of systems change seeking to advance health in a new and innovative way. So I would argue that a lot of your sites already have a bit of a head start when it comes to thinking about PSC change and how we're seeking to play a role in adapting and modifying this in a way. And the specific ways that your sites are seeking to pursue that might really be an indication of a tailored approach to some advocacy that you can be engaged in more sort of, if you want to call it more explicitly, or, you know, integrating that into your sort of overall objectives and goals and really kind of making those connections more clear. I think that there's also an inherent connection to our upstream PSC change. So much of what your sites are working to address and so much of what our public health field at large and our healthcare fields at large are working to address are really around root causes and social determinants. And this is something that Sue's been kind of hinting at and we've addressed time and time again. But we know that health touches every part of our lives and every part of our human experience and is really manifest in how well and how long we live. But these outcomes aren't just determined by who we are and what we do. You know, of course, they are a result of socially constructed circumstances that dictate the quality of opportunities available to us in our communities and across a lifespan, whether or not we can access gainful employment, whether or not we have affordable, healthy food options. I think the story that Erin shared around starfruit, I think really speaks to that as well. And of course, is an anecdote that we hear time and time again, but is really prevalent in our communities and across our work. You know, do we have safe spaces to walk and be active? Do we have quality housing, good air quality, good public schools, efficient public transportation? And we have access to purchase preventative health care. All of these things play into what we do. And they're all constructed along socioeconomic lines. And so, you know, we know that the absence of these resources manifest in chronic disease issues and those kinds of challenges. But it's important to keep in mind that those underlying root causes and those underlying challenges make our work inherently political, inherently social. And it means that when we think about PSC change, we have to think about ourselves as being very active agents of change making. And I think something that's been coming to mind for me, particularly when Sue was asking questions of Erin around the last presentation, is I think it's also important to acknowledge that when we're talking about things that are very politically charged, that are very real, that are our lived experiences, we're also talking about needing to be very vulnerable. And that's not just in acknowledging that maybe our interventions won't be successful and that maybe we'll have to deal with being open to failure or having to try more than once to get it right. But it's also understanding that, you know, when we come into the space, we bring a lot of ourselves to the space. We bring our passion, we bring our experiences. And so we could be very vulnerable to speak from your lived experience or speak to the things that you are dealing with or seeing in your communities that you're passionate about and that you care a lot about. And it's also leaves us open and vulnerable to risk. If we don't know if things are going to be successful and we don't know how taking a certain position or making a certain change will be received, all of these things, it's not, I suppose I don't want to suggest that it's all super easy and we should all just do it and dive right in and it's going to be fine. You know, it's on the one hand very natural, I think, to those of us in our spaces, but also it can be intimidating, it can be scary. And I think acknowledging that there's a vulnerability in this process, I think is really important. But I think we can do it. So I did want to, you know, really get specific into the specific elements of CACHI and your ACH models that I think are really primed to be leveraged for advocacy and for change making. And so I have a lot of ideas about how these 7 kind of components are already kind of baked in ingredients for core advocacy opportunities. I know that folks are maybe not a little bit, maybe a little quieter today. So I think I'll share some of my initial reflections and thoughts. And then I do want to open it up and get some feedback from you around how you think either these specific elements can be leveraged for some kind of advocacy or change-making effort. And also think about, if we have some time, brainstorming some of your ideas around what you might want to pursue, and maybe utilizing, we have Erin on, some of the experience that we can bring to maybe perhaps reflect back, or think through some of that. But I think, just going through, the 7 elements of your Akachi sites, you already really have a lot of ingredients that are tailor-made to facilitate some advocacy work. And so I think, as we've emphasized time and time again, the core of our advocacy work is really around our shared vision and goals, having a clear sense of your mission, your objectives, and as you work with your partners to develop that, you are really setting a framework for any kind of advocacy you're seeking to accomplish as a group and as a coalition. So I think it really starts there. And as you continue to build that out, that's a huge piece that you can utilize to dictate the types of advocacy, the audiences you're looking for, and ultimately the kind of change you want to see that might be within your specific organization or intervention, but of course might be much more upstream and might be larger. And there might be some, built-in advocates or partners that, might be non-traditional that you can bring into that as you continue to build your coalitions, which I think lends itself well to this idea of partnerships. You're building coalitions. You're really being mindful of who's at the table, whose voices, are included in what you're building. And that's incredibly critical. This, that stage is I think priming, what you might be doing for advocacy and really thinking strategically about the impact you want to have, the social change you're seeking to affect, and how you can engage the right people. And I would really emphasize the right organizations and the right, partners, of course, but also really think about the right community voices and community leadership in that process to ensure you have a critical mass to advance whatever issues you choose to down the line as you continue to pursue various options. And I would say if you are interested in policy change, big P policy change at a legislative level, be it local, state, national, having a strong coalition of partnerships at the front end will help you have everything you need to leverage to create a critical mass in support of anything you might be advocating for. I think that connects directly into your leadership and governance, thinking very strategically about who's at the table, whose voices are heard, and how that can really prime your community or your organization to be engaged in advocacy. And again, building in a coalition of support and really understanding the difference of opinions and the different needs of those coalition members, ensuring they're reflected in your work as well. I think backbone organizations, again, I mentioned earlier that if you have any kind of institution that has a set code of policies or procedures, that's an opportunity for systems change, and we have to hold ourselves accountable as well. So the ways in which we set policies as backbone organizations, the ways that we set a tone for how we convene people, all of these are sort of elements of the kind of advocacy we see ourselves engaging in and the success of that advocacy. I think Erin's examples and the work that RWJF is doing speaks really well to the importance of data analytics, capacity building, thinking about what you're collecting, what information you're collecting, how you can share it regardless of the outcome, how we evaluate our successes and define our successes. All of these things I think are really addressed very well in all of the examples that Erin shared. So I don't think I need to go much more into that, but case building and defining an audience, I think really stood out for me as huge opportunities there. Something that we talk about often is, looking at our innovative finance models and structures and things that we can do to help create sustainability in our work. And a wellness fund or any other kind of innovative finance model comes up very often. And wellness funds can look all different ways. There's so many ways to build them. But as you continue to think about yours, if there's an element of tax revenue or other kind of public funding that you see benefiting your wellness fund, it really goes back into whether or not, who's going to benefit from it and who's going to advocate for it. Who's going to help you shift certain policies or make a case for pooling funding in a way that you think will sustain your ACH work. And I think that inherently will require some thought into who we're bringing to the table. Again, what partnerships are we developing? How is that reflected in our leadership and governance? And who can come with us to really advocate that what we're doing is really benefiting the community in a way that we can actually bring those resources together and support our wellness fund effectively. And so I think that's, to me, I think the biggest, objective. I think sustainability speaks to a lot of people. And if you're able to bring partners along to really understand, why this is worth sustaining and why investing in a wellness fund and supporting that long-term is worthwhile, all of that is advocacy and an important piece of the work that you're doing. And then, of course, we have your portfolio of interventions, which are very varied and very diverse. But, all of this, regardless of the level of intervention, the type of advocacy you're doing, and the type of PSE change that you're seeking to accomplish, all of it really builds into, things that you are already doing and already engaging in as CACHI sites. So just to kind of bring it around and make sure we can be really tangible with actually thinking about and understanding the ways that you may already be engaged in advocacy or already very primed for advocacy are kind of evident in all the elements you have available. I do want to pause and I want to ask for questions. If people do have questions, actually I will leave these up so we can think through them. Sorry, I keep doing that. And really open it up for folks who might have reflections on that, reflections on your ACH or certain elements you find easier or more difficult to leverage. Any other questions around for Erin? We can pause for those.
Mm-hmm. Great, thank you so much. This was, that was good. I'm wondering, Heather, I'm just wondering, I'm thinking about you, and I know we've talked a bit about the training, and you're really trying to figure out how to implement that. I'm wondering if there's anything here that strikes you, or yeah, just any reflections. And you're on mute. Heather. I don't know if she can. I think I can, it says I can unmute her, but it's not letting me. Okay, anyone else? Just in terms of, it'd be great to hear any reflections from any of you, just in terms of this information and how you might use this in your work. Everyone is quiet. Well, Christania, I'm not sure what to say. I don't know.
That's okay. Well,
yeah.
what we can do is, we're very lucky to have Erin on with us today.
Yeah.
Maybe if there's other questions or other comments that kind of come up beforehand, maybe we can send them to you, Erin, and we can have you available for maybe any other follow-up that might come up. And I'm of course available. People do have other questions or want to talk a little bit more about the specifics of certain types of advocacy you might want to engage in. We wanted this to be sort of a sort of broader kind of 101 introduction, but if there are specific things that people want to get into, we're happy to also provide some support around that too.
Mm-hmm.
Absolutely. And we do, for other examples of the other sorts of projects that we have funded people to evaluate, there's descriptions of all of them on our website, which is evidenceforaction.org. And so I encourage people to take a look there. There's probably some types of interventions that are relevant to the work that is happening in the CACHI sites.
Mm-hmm. Yeah, that's good. I was wondering because, when I post this on the website, if there are resources, I just try to kind of cluster them with that. But, one thing that is also striking me, I'm working with a group to plan, the All-In conference, so the DASH, and had a conversation with a potential speaker. And there's you hear about health in all policies like that, and starting to hear kind of more, chatter around kind of health in all data approach. So, because I think, public health in particular loves data, and they love to gather lots of data. And I think, that notion of what you're going to do with it and what it means and who it might affect. I mean, to me, Christania, when you were going through the elements, just thinking about, I think it's helpful, like having that lens of your work and thinking about how you can do, like even in the backbone organization, right? How you run your business and what you do, who you hire. I think the leadership group, like all of those factors, I think it's just another lens that, I think would require a lot of conversation inside of the group, which gets to kind of their values. Like, what do we value that, is really important to us? So I just, there was a lot of things that kind of resonated for me, and glad that you brought them up.
Yeah, and health data is such a, I guess, double-edged sword maybe, because on the one hand, it's so robust and informative, and then on the other hand, there's HIPAA.
Yeah. So anyway, it's very, very interesting. Yeah, if you guys have, other resources, I think I can put the link to CA for Health and the link to Evidence for Action. I think, all of the case studies, I think will be really helpful.
Great. Sure. Absolutely.
Great. So I don't know if you guys have anything else. If there's, since we have such a quiet group today, I'm really sorry.
That's okay. The only other thing I'll add is just to, CA for Health is just one of many, many organizations that's doing work in this space. And if you are interested, even as staff or individuals who don't quite know how to navigate, I would say particularly Big P policy and kind of diving into that end of things, there are tons of opportunities, particularly right now. We have a lot of conversation going on with our state budget and a number of other local initiatives. We have a lot of advocacy days that happen in Sacramento. And I say advocacy because they're not all lobbying days. Like, there are a lot of things around education and advocacy and educating individuals about your work and what you're doing and what you care about, what you're passionate about. There are lots of opportunities to get involved at the federal level. I know, like, I'm in San Diego, I live on the border, lots of opportunities to get involved in lots of advocacy at the moment. And so, I would encourage, if it's not CA for Health or if it's not Evidence for Action, but it's another organization that might have those opportunities, encourage you to try, even if it's not quite what you're doing in your Kachi site. But if you're interested in kind of getting your toes wet and kind of exploring how that can feel and what it can look like and how you can tailor those opportunities to your work, I'd highly encourage it. I'd always be happy to pass on opportunities. We usually have them on our website. And if you know of any opportunities, we'd be happy to promote them on our website so other folks can start to join together. But just getting in the practice of things is a huge step. And we would love to connect anyone to any opportunities like that would be valuable.
Great. Thank you. Well, thanks to you both. I'm most appreciative of your time and energy and, just a lot of wisdom there that I think is really useful. So thank you.
Cool. Thank you. Thanks, everybody.
Okay.
Thank you.